you. Well, 2022, life was great. It was fast paced. Me and my husband had busy jobs in the NHS. Post-COVID, my 19-year-old son had started his second year at university and my 15-year-old daughter had started her GCSE years. So it's a lot to live for. I started experiencing new upper back pain and feeling a lump in my throat. That was in November. I was prescribed lansoprazole for suspected gastric reflux and referred for a physio assessment by my GP. I was reassured I didn't have any red flags and continued to think I was having disc problems. The pain was increasing, radiating to my right arm. Within 6 weeks, I had had 3 GP appointments, gone from no pain control to being on 4 strong painkillers, a muscle relaxant, and signed off work. I completed a self-assessment physio assessment at work because I was an NHS employee. The physio assessment referred me to an advanced physio, who reassured me he didn't think there was anything sinister, but due to the severe pain, would refer me for an MRI. I must admit, I hadn't even thought about cancer. It hadn't crossed my mind at this point. So the MRI followed. In January 23, the 27th, the day my world turned upside down. I was called by the advanced physio, who informed me that unfortunately there was something sinister in my scan and it looked like cancer, and my GP would be in touch. Well, I certainly wasn't expecting that. And thank goodness my husband was still at home at the time, so he was there with me. I was then asked to attend the Hallamshire for more scans that day to see a consultant. My goodness, I was in shock, but went into autopilot and in between uncontrollable crying, got to the Hallamshire. I had the scans, saw a neurospinal surgeon who confirmed I had a pathological T1 spinal collapse, causing pressure on my spinal cord with nerve root damage. Likely to be a metastasis from the mass in my right kidney that I didn't know anything about either. He fitted me with an X-ray, started me on hydrosteroids and gave me clear advice until the MDTs had occurred the next week. It was a lot to take in. So I had the weekend to inform my family, the hardest thing I had to do. My son came from Liverpool, my family came from Scotland, and we all wandered around in a daze. The spinal and neurology surgeons and oncologists called me the next week. Urgent spine surgery was a priority, so scheduled for the following week to stabilise and debulk the tumour in my spine. This was successful, and now I have an internal mechanical set in my spine. I really wanted the right kidney, and it had a 9 centimetre primary tumour, and the tumour thrombus in my right renal vein removed. So 3 weeks later I had that open nephrectomy. Started combination therapy 6 weeks later. I experienced most of the side effects mentioned over today during the consent process. These were manageable with medication until after 2.5 cycles of my Pembro, I started having severe stomach pain and my blood revealed I had liver toxicity. This required admission to hospital, IVs, intravenous steroids, and the Pembro was stopped. I was obviously very disappointed. This was supposed to extend my life. I had a family holiday planned to Mallorca the next week, which was really important to me. So the oncologist and the ward teams worked on magic, and I was able to go on holiday with my lovely family with a suitcase of medication, a blood pressure, blood glucose monitors, and I was able to walk through the security with my internal mechanical set with no incidents, thank goodness. 7 months of managing my liver toxicity with medication meant I had several treatment breaks, and restarting the Pembro seemed unlikely. I was frantically looking for alternative treatments with my oncologist. I had a PET scan to assess if I would be eligible for stereotactic radiotherapy. Results highlighted 6 bone mets, so I wasn't eligible. I was gutted and losing hope at this stage. My left arm, in the location of one of the mets, was getting worse. I was getting more pain from there. It wasn't due to progression, but I needed another mechanical set in my left shoulder and arm. I had 5 fractions of radiotherapy, and this followed, and then I had a wound breakdown, which took over a year and a half to heal because I was still on lenvatinib. But getting into the swimming pool sometime soon is looking promising, so I'm looking forward to that. A saving grace was my 3 monthly scans showed stable disease. I was still really concerned, so I asked about a second opinion, and my oncologist facilitated this at the Christie in Manchester. Unfortunately, I did not have a medical solution, which I was hoping for, but I left feeling confident I was in the right treatment plan for me, and hope, as he explained, about a TKI drug that was in research and a stage 2 would be coming out in a few years. In reflection, it was the best thing I did. It made me realise I should focus on the things that I can influence and control, and my diet, being as healthy as possible to tolerate the treatment, ride the emotional roller coaster and make the most of every day. Fast forward to 2025, and despite now having medication-induced dual osteonecrosis, I'm still here, feeling positive and feeling better than I have for a long time. I have a lot of faith in medical science, and I'm grateful for all the advancements that have brought me to here. I always liked singing and wanted to give something back to Weston Park, so I joined Sheffield Cancer Choir. It's a lovely supportive group, and singing makes me feel really good. We performed to raise money for Weston Park Cancer Charity, and my recent claim to fame, wait for it, was back in the Nolans at Sheffield City Hall last week. I'm still pinching myself. What really helped me, apart from my amazing family, friends and NHS, was receiving support from Weston Park Cancer Support Centre, the Cavendish Cancer Centre, Macmillan Kidney Cancer Forum, and obviously Action Kidney Cancer. They've all been invaluable at different parts of my journey. After Melville's retirement, I wanted to focus on making a difference for other cancer patients. So I'm a patient representative at Weston Park Patient Improvement Group, and I'm the chair of Weston Park Patient Public Involvement Group. I know that when I'm feeling okay, my family are okay, so I aim to feel okay as long as I can. I always have little targets to look forward to, usually in sync with my 3-month risk anxiety. Over the next 9 months, it's our 25th wedding anniversary, my daughter's 18th birthday, my son's graduation from medical school, and my daughter starting her university life. That's 3 anxiety cycles. Fingers crossed, I'm still here to celebrate these events. These little targets give me something to look forward to and keep me positive. There's always hope, and thank you for listening.